Dr. Levesque, introducing to you Dr. Barrett Levesque this morning. We're in San Diego, California, and we're going to be talking about health literacy. And Dr. Levesque, can you tell
Morning.
us a little bit about yourself?
Morning. Well, I'm a gastroenterologist at the University of California, San Diego, and I specialize in inflammatory bowel disease, which is a disease of inflammation of the colon and small intestine or other parts of the bowel. And glad to be here today.
Hey, thank you. Barrett, in the article that you had published in U.S. News, is it still World Report?
I'm not sure.
Well, we're in the news and we're looking at a class that's about local communities, schools, and families and how we can enhance literacy. And health literacy is becoming a very important issue for us in schools, in communities, and certainly in families. And one of the terms that's often used in families and early childhood programs when we're trying to get children to communicate with us is use your words. What's this mean in terms of health literacy?
I think in health literacy, it means we need to try to have patients using words that make sense to them. So I think patients sometimes come into the doctor's office thinking, well, what does the doctor want me to say? Or what did I read about on the internet? But really, what's probably the most useful to me as a clinician is how do they feel in their own words? Because I think the patient will be best at describing their symptoms in words that are familiar with them and not using jargon or words that are part of the profession, but maybe for the patient, not exactly what they would usually use at home. I think that's the key thing from my point of view.
Okay. One of the things that you talked about that fits in with literacy is present your symptoms as an analogy. And certainly analogies are something we talk about when we're with kids. It's a rock. Well, how do you teach this to a family member? Do you use them, or do you ask them in your own words, or how do you get them to understand that?
So I usually give some examples. I think it starts with, well, I might say, well, it looks like oatmeal, or it feels like there's a rock in my stomach, or it's a crushing type pain. And I think using these words that are visual for visual people can be helpful. Sometimes it helps to use analogous words for sound. So some people hear a tinkling sound or hear loud bubbling sounds that their partner or friend can hear from across the room coming from their intestine, and that's something that's important for me to know at times.
Okay. You also talk about family histories and life histories. How does this fit into health literacy?
I think family history can be part of a puzzle that we're trying to put together when we get to a patient who has a complicated set of symptoms or a complicated disease or even some of the simpler diseases, but there can be a piece of family history that is a clue to what could be going on. For example, celiac disease, which is an allergy to gluten. We hear about that a lot in the news and in the grocery store. Gluten-free this, gluten-free that. About 1% of people have it in the U.S. And so there's a strong family relationship. Many people have family members who have celiac disease. And so it's an important piece to find out. Another part is colon cancer and colon cancer screening. Patients with first-degree relatives with colon cancer can have higher risk of colon cancer or colon polyps. And so it's important to know that so we can set up an appropriate surveillance timing for things like colonoscopy.
What would you like to see happening in schools?
Well, I think in schools, probably a couple of pieces. One is just teaching patients to use their own words well, because I think if a patient comes in and can use their own words well, that's going to be a lot more helpful to me than knowing one or two words from the medical dictionary or from the internet. The other piece is, I think, seeing the doctor-patient relationship as much as they can as a partnership, where if they come in with the questions, especially about the symptoms that are bothering them most, and aren't hesitant to ask their doctor and bring up these concerns in their own words, I think they're more likely to be the squeaky wheel that gets the grease, especially in a time where I think there's more pressure on physicians and patients with shorter visits. It's important in that short amount of time that a patient can articulate in their own words, ideally, and be ready to voice their what we call chief complaint, and that way the doctor or other practitioner can address it and help the patient. I think seeing the doctor-patient relationship as a partnership as much as I can is important, And as part of that partnership, it's important to ask questions. And I think that can be a difficult hurdle with a traditional model, maybe of the patient just being there and having their lungs listened to and belly tapped on and take 2 of these and call me in the morning. There's more to it now, I think, in the current era. And language actually is probably a fundamental piece. They say 90% of everything is in the history when trying to find out what's happening with someone. And I still believe that. And it helps for a patient to be able to articulate that well.
Last thought. Our great doctoral students are leaders in their own schools and communities. What would be a next step for them from this course to go back to work in the fall? And if you wanted to see health literacy take on a fresh approach, where should they begin?
Well, I think there are probably avenues in the schools that could be utilized to take what you're learning in your course and applying it at home, and to see in a probably, I would think, a project-based manner if it can make a pilot difference in a small group of people, perhaps in your community or school. Perhaps that pilot program could be then tested in a larger project, perhaps grant funded, for example, or a grant from your city or state that could test the impact of this kind of teaching on health outcomes. Because ideally, I think when the rubber hits the road, eventually we want to see patients healthier down the line who use appropriate or health language that helps them get better. So there's probably a role someday for interventions actually, or projects, or that can be incorporated into preschools or whatnot, and maybe the outcome measure or the metric that could be used would be rates of vaccination or other intermediate steps, I think, that you could measure to say, or even just a survey of patient satisfaction with their doctor would be probably a pretty straightforward one. And if they're using this kind of language, hopefully that language they're comfortable with, maybe they just have a more satisfying visit. And I think that's part of actually the healthcare evolution, is that now there's more and more a focus on patient satisfaction, which is important, not just patients getting well. And that piece, I think, patients may be a lot more satisfied if they're comfortable bringing up their complaints and then, voicing them in their own words. And perhaps these are interventions that educators can work on and then test.
Well, thank you. You've got a busy day at the University of California, San Diego today. And my students back at Bellarmine University have things now with a challenge to move forward. Thank you so much for your time today.
Thank you.
Have a good day and a good week to all. Thank you.
Thanks.